بسم الله الرحمن الرحيم. ويسألونك عن الروح قل الروح من أمر ربي وما أوتيتم من العلم إلا قليلا. صدق الله العلي العظيم. My scientific paper titled Psychological Issues Among Children with Deaf and Hard of Hearing, presented by Dhafer Ameen, Jabbar Almossawy from Iraq. Objective of the study: the present study aims to assess psychological problems among children with deaf and hard of hearing (DHH). Objective 2: to find out the relationship between psychological problems among deaf and hard of hearing children with socio-demographic data such as age and gender and father job and mother job and other deaf child and family residence area and monthly income. Introduction about problem statement. Deaf and hard of hearing is a heterogeneous condition with long-term effect on social and emotional and cognitive development. Onset before language has been established happened in about 7 per 10,000 people. Increased rate of mental health problems are reported in deaf people. Many regard themselves as members of cultural minority of who use single sign language. The most recent report indicates that each year about 12 children per 10,000 live births are born with moderate and severe or profound hearing loss in both ear among Australian children at years 2013. A further 23 children per 10,000 will acquire a hearing impairment that required hearing aid because of accidental illness or other causes. Walker 2013, giving that initial survey of mental health of Australian children as example, and adolescents revealed that 14% of children were categories as being in the clinical range. A conservative estimate of mental health problems in deaf people and hearing impaired students who would be between 2,500 to 3,000, approximately 90 to 95% of deaf children are born to hearing parents. Methodology and research method by procedures to my scientific papers. Design of the study: a descriptive design cross-sectional study was carried throughout the present study to identify the psychological problems among children with deaf and hard of hearing during the period from 14 November 2021. Setting of the study: the study has been conducted on the children with deaf and hard of hearing living in Iraq, Najaf, at Al-Amal Institute for Deaf and Hard Hearing, located in Najaf city. Study sample and sampling: a non-probability purpose of sample of 107 children with psychological and behavioral problems were selected from Al-Amal Institute for Deaf and Hard of Hearing in Najaf city. Instrument of the study that uses a self-administered questionnaire composed of 2 parts. Part 1 consists of socio-demographic data and clinical characteristics of DHH children, such as age and gender and number of brothers and sequence among brothers and father alive and mother alive and father job and mother job and other deaf child in family and other deaf child among relatives. And second part include a brief symptom inventory. B B.sc consists of from 53 items scale by Goldenberg 1975. The study has been conducted on the children with DHH. DHH abbreviated for deaf and hard of hearing. Data collection. By the data were collected through the utilization of the developed questionnaire and by means of self-report technique with the subject who were included in the present study by using the Arabic version of a questionnaire gathering in one place, translated from an English version. And the purpose of the study was explained to them. The data collection process has been performed from March 25 month and 2021 years to July 6 July month to 2021 years. Data analysis. By using a statistical package for social science, abbreviation SPSS version 22, all the scale variables were normally distributed with small skewness and kurtosis in some variables. Appropriate statistical tests were used accordingly. P-value less than and equal 0.05 consider significant differences or relation. The statistics used frequencies and percentages and means and standard deviations and total score for PSS and reliability coefficient and chi-square for association. Result and discussions for this study. Figure 1, distribution of deaf and hard of hearing children according to gender. This figure shows that the total number of children was 107 divided to male and female. The majority of the study sample are male, approximately 57.9%, whereas the minority of them 40 and 2.1% were female. Table 1, statistical distribution, frequency and percentage of children with deaf and hard of hearing by their demographic data. This table shows statistical distribution of children with deaf and hard of hearing by their socio-demographic data. It's explained that the majority of subgroup are this between age 6 to 10 years old, about 43.9%, and male 57.9%. This who have less than 4 brothers, about 57%. This who live with their fathers and mothers, about 93.5%. Respectively, this father has a free job percentage about 59.8%. This who mother are housewives, about 88.8%, about 54.2% of them have other deaf children in family. Table 3, overall assessment of psychological problems for children with deaf and hard of hearing. This table indicates that the participant has psychological problem as total of score about 29% of them, such as somatization, obsessive compulsive and interpersonal sensitivity, depression, anxiety, anger, hostility, phobic anxiety, paranoid ideation, of all is psychiatric symptoms with children. Table 4. Association between overall psychological scale symptoms and demographic data for children with deaf and hard of hearing. This table shows association between overall psychological symptoms scales and socio-demographic data for all children with deaf and hard of hearing. The test contingency show that there is no significant association at p-value less than 0.05 between overall psychological symptoms psychiatric scale and demographic data for children with deaf and hard of hearing, except significant relationship with gender and number of brothers and father alive and other deaf child in family. This is significant relationship, and high significant relationship with gender only. Conclusion and recommendations. According to the discussion and interpretation of the study findings, the researcher has drawn the following conclusions. The findings from this study highlight on some psychological problems, psychological or psychiatric symptoms among children with deaf and hard of hearing that suffer from it, and which affect their social interaction and impede the level of improvement and promotion in their physical condition. Recommendations. The researcher recommends is appropriate and enough information regarding psychological problems of children with DHH are needed and very necessary to provide among parents of children to rectify their perception and dealing with deaf and hard of hearing children. This is a recommendation, as one of the most important aspects of psychological issues is financial one. Supported employed programs and lifelong financial help should be planned not only for the DHH children but also for the families. Another recommendation, counseling units can be established in the special needs center for coordination their services to the deaf and hard of hearing child and their family. Future researches to build up is also a recommended program to reduce the psychological problems among children with DHH, and a proper program should be applied to help them managing their psychological problems or psychological issues. Thank you so much. Thank you for your listening.